Good afternoon, everybody. Welcome back to our media update for what is happening with COVID-19. Today we're fortunate to again have people from neighboring counties here, our health department directors, those that are leading the charge on responding to COVID-19 are here to share with you what's happening across the Chippewa Valley. So we're pleased that we can make that happen. It's the last day of March. It's hard to believe that. The sun is shining and it's been a full month for all of us. It's been a tough month for everybody in one way or another, not just for the people that are responding, but also those that are having to change everyday activities so that we can control the course of this disease. So we start April tomorrow, not with April Fool's Day likely, but we will be continuing to talk to you and provide information and support to you as we walk through this. It isn't easy for any one of us. A quick status update about Wisconsin, and then and about the governor's work today, and then we'll move to updates from Chippewa County and then Dunn County. In Wisconsin, we have 1,351 positive cases of COVID-19 from testing. That's an increase today of 130 positive cases. 16 deaths. 2 more individuals died of COVID-19 since yesterday. And more than 17,000 negative tests. The stay-at-home order is still in place, as we all know. Testing capacity statewide is increasing. Prioritized testing is happening, and we're doing that for very important reasons. All of those things will make a difference in the number of COVID-positive cases in our state eventually. It won't change things overnight, so we anticipate to continue to see increasing numbers of cases. The governor today announced that he has requested of the president that we have a disaster declaration made for Wisconsin related to this public health emergency of COVID-19. Other states have already done this. Having a disaster declaration does pull down additional resources to the state. Some of the additional federal programs will be available to us in a different way if we have this federal declaration declared. Public assistance, hazard mitigation, some individual assistance and crisis counseling would be available, as well as some community disaster loans. The declaration was spurred because of the increasing number of deaths in the state and the increased disease in the state. We know that considerable state resources have been utilized already in responding, as well as local resources, and that declaration will make a difference in our ability to respond. So again, today we are hearing also from Chippewa and Dunn County, so I'll invite Angie Weideman up to share a perspective from Chippewa.
Good afternoon. My name is Angie Weideman. I'm the Chippewa County Department of Public Health Director. We currently have 9 positive cases of COVID-19 in Chippewa County. We are doing investigations on these cases, and all contacts have been followed up with. To give you a little bit more information about our numbers in Chippewa County, we have 338 people that have been tested total. 239 of those cases were negative or not a case. We have 90 current suspect cases where we're waiting for results to come in. We have 9 confirmed positive cases and 2 probable cases, which basically means that either testing was inconclusive or a person came in contact with somebody who was positive and is showing symptoms but hasn't been tested. Of our 9 positive cases, 7 of those individuals either traveled or were in contact with somebody else who tested positive, and there's 2 cases where we're still investigating with the State Department of Health Services. We are not saying that we have community spread at this time. We continue to investigate those 2 cases that we do not know where they contracted the COVID-19. In our county, with the 9 positive cases, 3 of our individuals are younger than 40 and 6 of our individuals are older than 40. We really look at our data quite closely and try to share as much as we can with keeping confidentiality of the individuals at stake. We also just want to reiterate that everybody is safer at home. As I mentioned last week, viruses do not know county lines. They also don't know who's at risk and who isn't at risk. Anybody can be at risk or put someone else at risk, so you really are safer at home right now. I know, as Liska mentioned, it can be difficult for people making changes and going through everything that people are experiencing related to COVID-19. I just wanted to give a few recommendations. I am a licensed marriage and family therapist, and there's a few things that I would recommend for families to think about. The first thing is creating a routine for yourself, especially if you're somebody who likes routine. That's something that I would recommend, is writing out your daily routine on a piece of paper and sticking to that routine so that you kind of have a plan of how you're going to spend your day. I also think it's good to do that with children, and I would encourage parents, especially parents who have children in school, to write out a routine with your child so that it's like, I'm going to work on math first, then I'm going to work on social studies, then I'm going to walk the dog, I'm going to have a snack, play basketball, come back and do science, and make your child a part of creating that routine. That helps give your child a sense of control. Another idea that I have is for adults to make sure that you are contacting other adults in your life, having conversations about the things that you're worried about. We never want to put our worry on a child. Children may have worries, and it is good to ask them questions like, is there anything that scares you right now? Is there anything that's on your mind right now? So it is good to ask children, but we don't want to put adult worries onto children. The health department also is working with all of our community partners and our incident command structure. And I just want to say a special thank you to our community partners. Many people are putting in long hours to make sure that our communities are safe and cared for. And remember that the health department is your contact for up-to-date, reliable information. And please stay at home, and we will get through all of this together. If you do have questions, you can call the health department in Chippewa at 715-726-7900, or you can email us at covid@co.chippewa.wi.us. And now I would like to introduce Katie Gallagher, the Dunn County Public Health Director.
Thank you, Angie. My name is Katie Gallagher. I am the Dunn County Health Department Director, and I wanted to give, again, a situational update for Dunn County. We continue to have 3 residents here in Dunn County that are positive for COVID-19. We have one person who is recovered, which is fantastic. We have another person that continues to be hospitalized, and then we have a close contact of that second case is our third case. Recognizing that all 3 cases do have either an association with travel or a known positive COVID-19 case. So like Angie had shared, germs don't know county lines. Many of us cross for work. Many of us cross for other essential travel allowed by the order. Especially germs, they are not stopping at county lines. And so what that means is that many of us are working together on contact investigations and disease follow-ups. So there may be a case that lives in Dunn County but works or goes to school in a different county. And we're working really closely with those partners across county lines to make sure that somebody from a public health department where you live is talking to you about what you did in the last couple days. If you stayed home, it's going to be a really nice short conversation. If you had folks over to enjoy the sunshine and maybe some beanbag toss, that's not going to be a short conversation. And so I really need you to recognize that we are all working together, but we need your help. You are safer at home, and safer at home means your immediate family. In Dunn County, we haven't seen the same kind of spread as we've seen in other places, but we are testing. I don't have an update for you today on the additional tests that were conducted in Dunn County, but we do see the WEDS, or the Wisconsin Disease Surveillance System numbers, and they are increasing quite a bit. And so we do anticipate more. But just because we anticipate more doesn't mean Safer at Home isn't working. We know that folks that are testing positive today really were exposed to the germ 10 to 14 days ago. Safer at Home, we just have a week under our belt. Give it time, it'll work. Our success is going to be measured in healthy lives of Wisconsinites. Give it time. So one of the other things that we've had some really poignant questions about, what does Safer at Home look like for me? Safer at Home means closing that circle of folks that you're interacting with. It means staying home for everything but essential travel. And that also does not mean having folks over for sleepovers and play dates and those kind of things where we're coming in close contact. It does mean getting out. It means, those three goods: good food, good exercise, good sleep. But when you're out exercising, please do it with social distancing and physical distancing in mind. It doesn't mean that the whole neighborhood goes on a group walk. Physical space. And then again, like I had shared, we are working across in some cases state lines, but an awful lot across county lines. So our Dunn County public health nurses, just like in Chippewa and Eau Claire counties, are contacting every known contact of somebody who is positive for COVID-19. They ask very personal conversation and questions about where were you and who were you spending time with? Who are you in close contact with? Close contact is 6 feet for more than 10 minutes. Do a quick mental inventory of where you were for the last 2 days to 1 week. How many times were you within 6 feet of somebody else for more than 10 minutes? Public health is doing that contact tracing. We're asking them, who have they been in contact with? Have they shown symptoms? We're working that disease investigation so that we can prevent spread. Help us out. Make it a short list, not a long list, of folks that are in your circle. We want to make sure that you are leaving the home just for those essential travel requirements. I know it's easy to want to run to the grocery store a couple times a week because you're bored, but that is not in line with the order. It's really going when you need to, being out only as long as you have to be, and really limiting the folks that you yourself are in close contact with. Because as we learn more, we recognize that there are folks that are asymptomatic, meaning they have no symptoms. And there are other folks that can share the disease or the germ before they even know they're sick. So we all need to treat ourselves and everybody around us as though we could have the germ or they could have the germ without even knowing it. 6 feet, physical separation at all times, even during essential travel. Help us help everybody stay safe. Thank you.
Thanks to both KT and Angie. It is a partnership across our counties in the state that is just critically important, and we're very, very fortunate to have strong local health departments on this side of the state, actually everywhere in the state, but certainly here in the Chippewa Valley area. It's really reinforcing to have that. An Eau Claire update. So in Eau Claire County, we now have 12 confirmed cases of COVID-19 from testing, an increase of 1 since yesterday. Our testing numbers are at 602 individuals tested in Eau Claire County with 457 negative tests. Again, We do not meet the definition for community spread, although Wisconsin continues to be a community spread state. That definition is when you don't know where those cases may have contracted the disease. All of our cases, like you heard described previously from the 2 counties, are ones where we have an understanding from travel or close contact that they are cases. Not having specifically met the definition of community spread in Eau Claire or any of the other counties in Wisconsin doesn't mean that we don't have COVID-19 here more broadly. As KT just described, we know that COVID-19 is here in places where we haven't tested. Testing is still being done for those individuals that meet the highest priority in most cases. And it's likely that there are more people in all of our communities that are positive for COVID-19. The majority of people that get COVID-19, again, are people that aren't severely ill. They don't interact with the healthcare system at all. We also know that the stay-at-home order is in place in all of our communities, and a lot of work is happening, as was just described. In Eau Claire, we are receiving phone calls in our call center about this issue, and we are following up and making sure that the order is followed. We also know that the order is not easy for everyone to follow. There are definitely circumstances for many people in our communities where the order is challenging. Those people experiencing homelessness is one of the primary groups that is of concern. We do, as of the end of last week, have a different facility for individuals experiencing homelessness, adults experiencing homelessness in Eau Claire that is now available to those individuals to make sure that physical distancing is possible. It's one example of the things that have been happening in this community to work on that issue. For some families, it's also not safe to be in the same household with your family members, and there are resources in our community to also assist with that. Bolton Refuge House is one of those, but there are many others as well. Elderly that live alone are another significant population, and again, reach out with your phones and contact elderly neighbors. Make sure that they are okay. It is possible, even under this order, to make sure that those individuals that are isolated and alone are safe, and we expect that we are doing that for one another. Childcare continues to be an important issue. Again, a reminder that we've given regularly, but the 1-800-782-1880 or childcarereferral.org resource is available, particularly for those that are working in essential businesses and are struggling with childcare. Probably the biggest topic for many people this week, up until next Tuesday when voting actually happens, is keeping poll workers and voters safe in the election. A couple of quick reminders about that today, and I'm sure we'll be talking about it at subsequent media events as well. There's strong encouragement for voters to vote absentee. If you have not done that and are able to do it, go to myvote.wi.gov, and until Thursday, this Thursday, April 2nd at 5 p.m., you can do that voting through that absentee process. You will receive a ballot in the mail if you do that process in time, and those ballots need to be returned to the polling site in the envelope that you receive by 8 o'clock p.m. on Election Day. You can also contact your municipal clerk for more information about this. If you do vote absentee, someone will need to witness that vote. My daughter did it for me, and I did it for her. She's in my household, and we exchanged signatures on our ballots as we did that vote. Again, this can be done by someone that you live with. If you live alone, there are other alternatives. You can work with someone that is coming to your house because they are helping to care for you and have that person witness your vote. There are ways to do it by making sure physical distance is kept, by doing something in the house where they're witnessing you voting through the window and then passing your ballot out so that they can sign it in that kind of a process as well. Again, if you have questions about this, you can certainly call our COVID hotline or your municipal clerk. Voting in person in the City of Eau Claire is happening for City of Eau Claire residents through a drive-through process. You may have seen this in other media reports. Again, you can drive, walk, scooter, or bike through that drive-through process. Bring your ID, bring your proof of address, and that is another way, again, for City of Eau Claire residents to also vote before the actual election day on Tuesday. Our incident command group in Eau Claire is working very closely with the people that are responsible for making a safe and effective vote happen across the county. Right now, actually, as I speak, a communication is going out to the workers of those sites. We have 37 sites in Eau Claire County, so you can imagine the number of places we have to assure that we have a safe and healthy vote happening. 20 of those sites are in the City of Eau Claire, but 17 are outside of the City of Eau Claire limits. So we are meeting with those municipal clerks, with those individuals responsible for setting up the election safely, and walking and talking in a local way through the guidance that they've received at the state level. It's been an important part of what we've been doing this week. Some other incident command updates for all of you. We met with healthcare partners, all of our 3 hospitals today, via a phone link, of course, and had a really important and meaty discussion about where we are going in the future. Healthcare is meeting the needs that we have right now in the community for testing and treatment of people that have COVID-19, but we are all seeing the reports from other communities and other states and countries about when the peak happens, are we going to be prepared? And I know there have been many questions about that. We do continue to partner with those groups so that we have a countywide response, not just a facility-by-facility response. We continue with our public information to try and get information out to all of you. We have a number of people working very hard on that, and certainly if there's input on resources or information needs that are out there that people have, please let us know. Making sure messages get to specific populations is of particular importance, and we are really trying to ramp that up right now. We know that there are groups in our community that don't have as easy access to information and resources because of language barriers, because of other barriers, and we see that as important. If you are someone that has good connect to some of the populations that may struggle to get the information that we have, please let us know, and we'd love to also work with you. So we now have an opportunity for questions. I would say overall that we continue to respond as we need to. We know we are just at the start of this, so to acknowledge that yes, a lot has been happening and people have been working hard in response. We know that with increased testing, there will be increased cases, and that will continue to keep the workload large for all of us. We also know that we are really only a very short amount of time into the stay-at-home order, and that impacts all of you because of your businesses, because of your families, and we know that this is the long haul that we're doing this. So questions that you may have for any of the 3 of us at this point in time. Yes?
So you said there are 12 Eau Claire County cases. Are any hospitalized, and how many, if any, have recovered?
So of the 12 cases, we are following up on all of those cases, and I don't have specific information on hospitalization. Again, one of the challenges with hospitalized data is that we can tell you now someone is not hospitalized, and by the time we get downstairs, that may have changed. So all of the cases that we have, all 12, are in very close contact with our public health staff, and all of them right now, as far as we know, are doing well. And the additional question was, and I'm sorry, I've forgotten.
How many, if any, of them
Have recovered, thank you. So the second question was how many have recovered of those cases. There's a strict definition of recovered cases for the state. So at this point, none of our cases meet that official definition for recovered. Yes?
There still seems to be a lot of confusion for people who are told they have to go get tested, but then they go somewhere and they're diverted to somewhere else. What advice would you have for people, maybe they're new to the area or they just never go to the doctor, they don't have a primary care physician? what would be recommended for them in regards to where can they go and get a test done if they're told to go get tested?
Yeah, so the question is, what happens with people that are told to go get tested and may or may not have a healthcare provider to talk and walk through with them where to get that test, whether it's a priority test, whether they should be tested or not, frankly. The recommendations continue to be that for the majority of people that are connected with a healthcare provider, that if they have significant symptoms and need to talk to a healthcare provider, they call that healthcare provider, talk and walk through with them that situation, and then they are either recommended to get a test or not recommended to get a test. And in those situations, they'll be told where to go for that test. We do know that there are situations for individuals where they either do not have a healthcare provider or they don't quite know who to call. People can certainly call our COVID hotline. Again, that's 715-831-7425 number, and they will get connected to a public health professional in our shop that will help walk them through that. We did have a significant conversation with our healthcare partners today about that issue, and we are reassured that we will have a resource across those system partners to make sure that people, even if they don't have a healthcare provider on record, that they will, in those cases where they need to be tested, and if they need treatment, will be treated. We know we have a source for payment for that from the state, and our healthcare providers, all three of our hospitals today, did agree that there is not a barrier in our community for that to happen. We know that we have the healthcare system here that we have that really serves a regional footprint, and so they are working together with us to make sure that people can be tested and treated in those cases that they need to be. Yes?
So we know that the distance apart should be about 6 feet, around 10 minutes. Could you explain, are people not at risk if they are around somebody less than 10 minutes?
Okay. So the question is really the kind of the details around the physical distancing and the details around the investigation, frankly, that we do when we do contact investigation. The definition of a contact to a case is, as we've described previously, that 6 feet and for a duration of time, at least 10 minutes. Those are the people that we are telling that they need to self-quarantine, and we need to have them monitor their symptoms in case they develop disease. It's, again, to keep the disease progression as small as possible. With the stay-at-home order, in the abundance of caution, we are saying not only 6 feet and less than 10 minutes, but just your household. The reason for that added public health measure is that the circle of spread then stays very, very small. And that's really our goal with this public health measure of stay at home. It's an additional item on top of the distance and time. People may remember that we started with having smaller groups, the 250 or over, and then we had 50 or over. That was about the number of people in a space. And this is just yet one more public health measure. So in your household, stay close. In essential businesses, again, those things that we absolutely have to have continue to run in order to keep our world moving forward and responding to this event. Those places we're really pushing that 6 feet distance is critically important. What we don't want people to worry about is, I was 2 feet away walking through a doorway at the grocery store, and I think I walked through when another person walked through. Now I have to figure out what their name is. No, you don't need to do that. We're not concerned about those incidental contacts when people are quickly passing one another. We're worried about those more sustained contacts for disease spread. Other questions? Yes?
Does Oak Brook County have a breakdown of how many cases are underreported or over 40, kind of like Chippewa County?
Yeah, at this point in time, we are not reporting those numbers. The state numbers are showing a pretty equal distribution around the age groups, like we would expect, and gender. And at this point, we're not reporting based on age.
Is there a reason why why Eau Claire County isn't, reporting that?
Sure. So the question is there a reason why Eau Claire County is not reporting that? Again, all of us really adhere to making sure that we have careful look at personal health information, and we are approaching that slightly differently, but overall we know generally our cases are very similar to others in the state, and in the abundance of caution, we are just making sure with our small numbers that we keep it very general. It's also, I think, helpful for people to understand that we do have cases of all age groups in Eau Claire County and in all of our counties, and the point of reporting ages for the state as well as some localities is really to share that it's not just old people that are getting this disease, and that's really the point being made by health department directors that are talking about age. Again, the same is true in Eau Claire, the same is true in Dunn and all of our counties. We're seeing disease across the age spectrum. Yes?
Yesterday you'd spoken on, a couple times you've spoken on the county's working on an overflow potential.
Mm-hmm.
Can you maybe specify a little more what facilities are being looked at? And like, are we talking about dorms? Are we talking hotels? Are these places that are pretty much set? And if they're not, I guess, what kind of prep work, how much time would the county need, if they're needed, to, I guess, make them safe for people to to be at, or to accommodate people who may be sick?
Sure. So the question is really about the facilities that we've been talking about for various purposes in the community, and this is again happening statewide. How quickly can we get those up and running? How secure are they in our location and in locations across the state? And how do we know that we can have those facilities able to do the function that they need to do when we need them? So there are place-based needs for a variety of reasons. Again, healthcare conversation today had multiple agenda items about this, and do know that there are conversations across the state about this topic. We have clear locations for individuals who need a location to be either isolated because they're ill, but they don't need healthcare intervention. They don't need to be in a hospital or in an intensive care unit, but they're sick and they need to be away from other people and they can't be at home. We have places, typically hotels are the majority of those locations in our community, assured that we have space in those and we have payment sources to take care of that. So that is completed and ready to go. Also for quarantine, so for those individuals that are required to quarantine because they are a contact of a case, we also have those facilities available. Again, those are individual rooms for the most part where people can stay in place. Our healthcare providers are also looking at facilities and working with a variety of institutions in Eau Claire for the potential need for healthcare workers to have a safe place to go. Again, residential-like facilities. The dorms have been looked at and a number of other hotels. Again, those are in process as we speak and would be a location for a very specific group of healthcare workers and first responders if we got to the point where that's needed. That's not happening yet in places around the state, but we are preparing for the fact that that might be something that is needed if we can't use the stay-at-home order to get to a place where we have fewer numbers of cases. The final type of facility we're looking at is the one that we really hope we don't need to use, and that is a place for medical surge is what it's called, and that medical surge is for a location if we don't have enough room in the hospitals to meet the care needs of those people that need to be cared for in a hospital setting. Do we have another place for those people to go? We have worked with one local facility to have a small amount of space for some surge and overflow, and we are coordinating now in the region to make sure that if we get to that point, that we are not scrambling to find a location. Army Corps of Engineers as well as the National Guard have been working with places on the southeast side of the state to find locations, and they've identified a couple now for things like that, and we're learning from that experience. So those bigger facilities where we might need to have active care happening are being worked on. Yeah.
Can you tell us what any of those sites might be, the bigger ones? I can think of a couple possibilities, but.
Yeah, so the question is, can we share what those facilities are? We really haven't nailed down in detail. They have been all identified. They're being vetted right now. And those facilities it would be a whole process once we know what the actual need is to figure out which is the best facility to make that happen. So certainly, even if I could share with you right now, we still have a list of potential facilities, and we're trying to identify, based on a guidance that we actually received this morning, which one of those facilities might work best for different circumstances. Other questions? Yes.
Grocery stores, obviously they're still open, people can go and still get their food.
Mm-hmm.
Do you guys have any guidelines for if someone gets produce, a bunch of apples or something? There tends to be a lot of pick through of that kind of stuff,
Yeah.
and you can't necessarily wipe off an apple with a Clorox wipe.
Mm-hmm.
Making sure that food is safe to eat, and just that the groceries that are in your home, if they've been shuffled around by a lot of different people who maybe they didn't realize they were sick and they weren't.
Mm-hmm.
I guess guidelines in that aspect.
Sure. So the question generally was about food safety, both food in grocery stores as well as food once you get home. Our best measure for safety is wash your hands. I mean, that is really our best recommendation. Wash your hands before you go into the grocery store. Wash your hands at home when you're touching food. Wash your hand as you're preparing food. It's true anytime, but it's particularly true right now. Hand washing is our best measure. The second measure is don't go to the grocery store if you are ill, and that has been a very, very clear message to everybody. Grocery stores have been getting very specific guidance from the Department of Ag, Trade, and Consumer Protection. That's the group that works to provide guidance as a place that sells food, as well as from all of our local inspectors that work with them on a daily basis to make sure that their grocery stores are safe. So they have really clear guidance on how to make sure that their fresh produce, as well as all of their other grocery items, are staying safe for individuals. I would not be worried about buying apples and broccoli at your grocery store. I've been doing that. Certainly we recommend that you wash your apples and wash your broccoli before you eat them, and that would be true anytime, not just in this situation. Other questions? Again, thank you, everybody. We appreciate people paying attention to what's going on locally. We appreciate you sharing this information with people in your circle. Again, we know some people still are learning what they should be doing. We appreciate that it's hard to stay home for those of you that are having to do that. And it's hard for the people that are in essential businesses and in essential work to do that work. So hold each other close in your thoughts and hold each other close in your messages over the phone, but keep some distance and help us decrease the spread of this disease. Thank you.